I'll just get a few things out of my bag and then I'll begin to take a little look at you and we'll see what's going on with you. Alright, I've got my laptop there and it says that you've had flu. Yeah, okay. But you've got a very bad sore chest. Alright, and you're still not feeling very well. Okay. Right, so let's just grab a couple more things. I'll probably have to delve back into there at some point, but I'll get a few things that I know I need for now, my lovely. So you just relax there, okay? Let me take care of you. I'll just pop some gloves on. Because you've got an infection, I am having to wear some PPE, in case you were wondering. I don't want to pick anything up or infect any of my other patients. It's so easily done. And I'm obviously going to be very close to you. Right then. Okay, so when did your flu symptoms start? About a week ago. Okay, so aching, fever, alright, okay, and you've done a COVID swab and it wasn't COVID, okay, yeah, there is a lot of flu around at the moment, okay, so have you been taking any medication? Painkillers, drinking lots, okay, are you eating? Okay, so yeah, that's normal not to feel quite so hungry, but okay, alright, so have you got a cough? Yeah, okay, and can you show me where the pain is? Okay, so across your chest there, in your back? Alright, and is it hurting when you cough? Yeah, and your ribs hurt when you cough, okay. Sometimes if you've been coughing a lot, it's not uncommon to get some pain around the ribs and back and abdominal muscles. Yeah, flu can leave a very, very nasty cough. Because what we need to check is that you haven't got a bacterial infection following on from that flu. Because obviously we don't treat flu with antibiotics, but if I think there's a bacterial infection beginning, then we would need to give you some antibiotics to help you along with that. Okay, alright. So I'll just have a little listen to your chest, okay, if I may. Good. Alright. Just warm this up for you. Okay, I'm just going to place this on your chest and ask you to take some deep breaths as much as you can. Okay, if you feel you want to cough, just pop up your hand. Okay, alright, there we go. So a nice deep breath in and out, and again, and again, in and out. Again, alright, just going to pop round the back, in and out, and again, in and out, okay. And round this side, in and out, and in and out, okay. Now could you just do a little cough for me? I know it's probably going to be a little bit painful, my lovely. Okay. Okay. One more. Thank you. Okay. I'm just going to take your blood pressure if that's alright. And put this cuff around your arm. There we go. Perfect. Okay. And I'll just be inflating the cuff with this. Alright, going to put the stethoscope onto the crease of your arm, like so. Right, this will go very tight on your arm, okay, but it won't be for long, okay. Here we go. Okay. Okay, that seems fine. Okay, just get that air out of there. Right, let's just pop that down. Get rid of those for now. Okay, there we go. So I'm going to check your temperature. Alright, just going to pop this inside your ear. Lovely. You'll hear a couple of peeps. Okay. Here we go. Okay. Alright. The temperature is a little bit up. It's not too high, but I still suspect we've got some more infection going on there. That's why. Have you taken any paracetamol today? No, okay, because that could affect your temperature. It will bring it down a little bit, but not to worry. We can get you some medicine afterwards if you need be. Okay. Alright then. I'm just going to pop this on your finger, my lovely. It's a pulse oximeter. It'll just tell me how much oxygen you've got in your system. Alright. I'll pop that on there. There we go. It works very quickly. Okay, yeah. Your oxygen sats aren't too low, but they're not perhaps where they should be. Okay. Could you take a real deep breath in for me? Okay. And out. Alright. I can hear a wheeze there. Have you been experiencing some shortness of breath? Yeah. Okay. Do you suffer from asthma? You've had it in the past, okay. Sometimes you have to be careful with infections. They can trigger, obviously, some nasty respiratory responses. Okay. Yeah, just checking your notes on the laptop there. Okay. Alright. So, just like to have a little feel of your lymph nodes. Alright, my lovely, just down your neck and on across your shoulders. Okay, keep nice and still for me, sweetie. There we go. Perfect. Is that sore? Okay. A little bit swollen, a couple of them, but I'd expect that in an infection. Let me just check across your shoulders. Alright, okay. Just rest up there. You got any pain in your sinuses? Okay. Typically with flu you might not get so much of like a runny nose like with a cold, but you can get some sort of pain and a kind of congestion. Is that what you've had? Yeah. Okay. Are your body aches gone now? Good, that's fine. I'm just going to gently press across the sinuses. Okay, across those maxillary sinuses. Okay. Alright. A little bit tender. Okay. Okay. What about your ears? Feel a bit sore and congested in your ears. Okay. Alright then. I'm just going to get my otoscope. I'll have a little look up your nose and in your ears as well. Okay. Right then. I'll just pop a new tip onto my Otoscope. Okay, perfect. Alright. Let me just have a little look at your nostrils, okay? I just need to press on your nose ever so slightly, my lovely, okay? Alright, keep nice and still for me. There we go. Okay, look a bit red and irritated. Alright, okay. And let me just have a look around your eyes. Have your eyes been feeling sore? I've seen a few people with this flu who've had very sore eyes. Yeah, okay. I'll just have a little gentle look with this, okay. Just have a look around those eyes. Yeah, look a little bit red, but you're probably very tired, aren't you? Yeah. Okay. Just have a little look. Yeah. From that corner. Okay. I'm going to have a little press around your ears, alright, and have a look down your ears just to make sure there's no infection going on there. Okay? Alright. So, I'm sure you've had an ear exam before, but I just need to pull up and back on your ear a little bit, okay? Just to get this in. And I'll be very gentle. If anything hurts, please tell me. Okay, my lovely. Alright, just relax there. There we go, just pulling up and back a little on there. I'm just going to pop this in. There we go. Having a little look around. Okay. Not looking too bad actually. Maybe a little inflamed, but I can see the eardrum and that doesn't look like it's bulging or infected, so that's good. That's good. Okay. Yeah, okay. Just reposition that slightly. Well done, my lovely. That's perfect. I will draw that now. Okay. Right. I'll have a look round your right ear and just up and back there. Okay, and just insert, and I'll check around the outer ear. Okay. Alright. Yeah, everything seems fine here too. Again, just a little bit red, but the eardrum looks fine. So I don't think we're dealing with an ear infection. Okay. Well done. That's perfect. Right, let me just withdraw that now. Okay. Wonderful. Okay. I'll just have a little press around your ears, okay, and just check the little lymph nodes just behind, okay. Tell me if anything is uncomfortable, my lovely. Okay. Okay. You're all right there, sweetie. do seem fine. Yeah, I'd like to have a look in your throat if I may. Okay. Let's get in the bag and find a new tongue depressor. There we go, a different compartment. Always hiding somewhere. Okay. There we go. Found it. Okay. I'll just ask you to open wide for me, my lovely. I'll do this as quickly as I can because I know it's not very comfortable. I'll just pop that in there. Okay. And I'm going to have a look in with my light as well. Okay, could you just say "ah" for me? Okay, and again. Alright. Throat looks a little bit sore still. Yeah. Okay. Alright. Okay, just "ah" one more time. Okay. Alright, just relax now, thank you. Okay, put that there. Just update that. Okay, so what I'm going to do now is just have a little press around your tummy, okay, and a little percuss around your chest, alright? Just want to make sure that the organs in your tummy aren't swollen or anything like that. Okay, tell me if anything's uncomfortable. Alright, just relax there, sweetie, okay? Okay, could you just take a nice deep breath in for me while I push down there? Okay, and breathe out, lovely. And again. Okay, and breathe out. One more time. Okay. Let's have a little tap around now. You're right there. Good. Okay. I'm just going to have a press around in the lower abdomen as well. Alright. A little feel around there. Nothing's tender, no. Have you had any diarrhea with this flu? Okay. Alright. Okay. Alright. So I'm just going to have a little tap around your chest area. Alright, you just breathe normally for me, okay? Sorry if that's a little bit uncomfortable. Okay. Alright. Just relax now. Okay. Right. Well, I think that I'm going to have to prescribe you an antibiotic, okay? It does sound like you do have a chest infection. Yeah, which isn't uncommon after these illnesses, okay, particularly with the discomfort that you're getting. If it's just a bit of a cough towards the end of a virus, then we would probably leave it a little bit, but your chest does sound rather angry. There is some wheezing and some crackling sounds. Yeah, and you do have a bit of a fever as well, and feeling generally, under the weather, aren't you? Yeah. Okay, So I'll prescribe you a drug called co-amoxiclav. It's also known as augmentin. Okay, so it's got amoxicillin in it because I can see that you're not allergic to penicillin. Okay, but it's also got another component to it as well. Okay, which makes it very, very effective. All right, you've taken amoxicillin before, haven't you? Yeah, I can see that on there, so you're okay with those. But I'm also going to prescribe you a Ventolin inhaler as well. Okay, just use that for the next week and see how you go with the breathing. If your breathing does feel worse, please call us back. Or if it's out of hours and you really feel unwell, go to A&E. Okay, but it should help. Quite often we prescribe an inhaler as well when you have chest infections, just to help you breathe. Yeah, because it does sound quite wheezy in there, and with you having a history of asthma, we want to be very careful. Yeah. Okay, so let me just check. It's the surgery pharmacy, isn't it? Yeah, okay, well they're open for another couple of hours, so you've got someone that can go and get your medication? Yes, okay, well I'll send that straight over now. Just bear with me, I'll just get that prescription put on, and it'll go straight over to the pharmacy. So the antibiotics I want you to take 3 times a day for a week, okay? Okay. Sometimes it's best if you take them with food, just so they don't irritate your tummy, alright? Okay, and I've got the Ventolin. Okay, I'll prescribe 1 inhaler and just have 2 puffs 3 times a day on that. Okay, that's lovely. So that's gone over to the pharmacy now. Okay, so I'm going to leave you to rest, my lovely. Okay, and I'll get cleared away here and I'll go and move on to my next patient. But if you do feel worse, always call the surgery back. Okay, so you get some rest. Alright, and your friend will get your medication for you and you can start that today. Alright, remember to drink plenty and take some paracetamol as well, okay? Alright, close your eyes and rest, and I'll just pack up and I'll let myself out. Okay.